Thank you, sir. Very kind of you. Now, I would like to invite the panelist for the next session. That's the Young Ophthalmologist Society of India session. At the outset, I would like to thank BOA and MOS, especially Ragini ma'am and Lhane sir, for giving us the opportunity to conduct this session, and also the whole YOSI team, especially Dr. Devakant Mishra, for enthusiastically participating in organizing this session. First, our chairman would be Dr. Devakant Mishra, who is the secretary of YOSI. Co-chairman would be dynamic phaco-refractive surgeon from Ahmedabad, Dr. Shail Vasavada. Co-convener would be Dr. Dipti Kulkarni, vitreoretinal surgeon from Meerut, and Dr. Ashish Bachau is a cornea specialist and anterior segment surgeon from Thane. First, I would like to invite Dr. Devakant Mishra to give an introduction for the session and also introduce us to various activities of YOSI. Dr. Devakant.
Thank you so much, Dr. Rohit, and thanks to BOA and MOS for this wonderful opportunity. So I'll quickly try to run through all the activities that we have been doing and brief history about YOSI as well. So it was started way back in 2014 under the leadership of Dr. Vijay, Dr. Tarun, and Dr. Digvijay Singh at that time. And we started out with three main activities in our mind. First was to generate a platform for young ophthalmologists to generate content that is relevant to yours and preferably by them as well, and to identify issues and to raise them and escalate them to the higher authorities. This is the present team that we are working with, and a few of us are here today in this session as well. So our first initiative was to create a publication for the young ophthalmologists. That was the YO Times, Young Ophthalmologist Times. And we have brought out almost 17 issues, and all of them have been very well received all throughout the world. We started with physical meetings way back in 2015, which was slowly followed up with our annual event in collaboration with the AIOS. And recently this year, we did the AIOS UC Forum on a virtual platform, and we were very happy to have over 20 delegates from international YO delegates. Coming to the state activities, all of these states have been very kind and very generous in giving us space in their programs. And these are images from some of them. This was the 2019 MOSCON YOSI session. And similarly, all the other states have been very supportive in all our activities. Similarly, we thought that we'll decentralize our activities, and we started forming state chapters. So Maharashtra is one of them, and a few others have been creating, and many created, and most of them are in the pipelines. We have an annual YO Pavilion at the AIOC, and it has been hugely successful. And with Dr. Modi's support, we were able to bring in the YOSI Hackathon, which was highly successful there. Then we did a lot of quizzes, and we collaborated with the subspecialty societies all throughout India, and they have given us sessions in all of their meetings. So very happy with the support that all the young ophthalmologists has received. Of course, this is the time for webinars, and we did a lot of webinars, and our recurrent meetings like the late night retina, surfing the anterior segment, and recently started YOSI journal clubs have been very popular. We have an annual writing competition which has been held up because of the pandemic, but annually we do a writing competition, and the winners are awarded during the annual meeting. The biggest international news for us last year was that YOSI became an ICO member, and ICO invited us to conduct the first YO symposium at the WOC. Similarly, we have collaborated with APO and almost all the other major YO societies and societies all across the globe, the American Academy, the Turkish Academy, and all of them. And during the pandemic, we were able to collaborate with them through webinars and online meetings, and we formed the Asia Pacific YO Consortium as well. So these are few glimpses from that, and I request all of you to check out our YouTube channel and submit to them. Similarly, the YO Flash Notes, Dr. Avnish is taking care of it, has been very successful. We have a fellowship help desk, which is now involved onto a more dynamic role of help desk, where we help young ophthalmologists in their fellowship queries and various other queries that they have. We have a job portal where you can post your vacancy and upload your resume as well to get access to jobs, which are exclusively for young ophthalmologists. So where they take people with lesser experience also, we try to highlight those jobs. To appreciate the tremendous work that young ophthalmologists are doing all throughout, we have the few awards. That is the Young Ophthalmologist Award, and the Best Flash Note YouTube also get awarded every year. We are almost 4,000 members strong right now, and we are working on few programs like the YOSI Mentor-Mentee program. And when traveling and all these things resume, we are working on research and travel grants as well. So thank you so much. And today's session, we'll try to cover everything that a young ophthalmologist has through their various phases of their lives. And Dr. Rohit, over to you after this.
So next, we would like to invite Dr. Sonal Kalia. She will be guiding us on how to nail the residency exams. Dr. Sonal, over to you.
Thank you so much, Dr. Rohit, BOA and MOS for this presentation.
Greetings from Jaipur. It's a daunting task to summarize about PG exams in 7 minutes, especially seeing the tough times brought on by the scourge of COVID, but I will try to share a few points. Like the Olympian who has broken the record umpteen times in practice on his home ground, one has to be prepared in advance. With a growth mindset, you will keep on learning lifelong, be it at consultant level or resident level, especially in areas of your interest. But you have to be able to manage your time to finish the entire syllabus before your exam. Your COVID posting, death, or health, date of exams, lack of patients or surgeries are things out of your control. But the clock is ticking real fast, and you have to act smart. You can make a schedule for the time that you have left with tentative exams in mind. We look at the latest 2021 guidelines, though the guidelines keep changing, but the NMC permitted the use of clinical photos in MBBS exams on 9th April 2021. NEET PG was delayed and third years have to continue duties for some time to come. Thankfully, they would get accommodation and stipend. On 22nd April, exam via video conferencing in hybrid pattern was also allowed, but then exams were delayed at many centers. Dedication and the desire to learn are the quintessential qualities that your teachers would be noting during residency. They have been observing you, and your desire to learn is of utmost importance. Your exam could be traditional or hybrid in 2021, but the underlying requirement remains the same, that one has to be able to present what one has learned in the given time. You have to reduce your stress levels because knowing your basics well is of paramount importance. Real growth occurs when you step out of your comfort zone. We all have topics that we are unfamiliar with, uncomfortable with. So it is a good policy to spend time equally on topics that we have not read in as much detail or need more revisions in. It's a common dictum in medicines that knowing the uncommon manifestations of common diseases is also very important. If you know the details of rare disorders but falter on basic tests like FFA in diabetic retinopathy, you would not be impressing your examiner. Yes, exams are the ultimate goal, but one must study from standard textbooks like Jacobi to understand the concepts and also read good quality review papers. To be able to retain, revise, and reproduce, making extensive notes from plethora of resources available is very useful. So that right before the exams, you have all the points about the topic in one place, easy to revise because you have the diagrams, charts, trials, and under appropriate headings. Making notes by hand or iPad is a good way to practice and revise your written answers. Observe the examination pattern of your seniors, which is a good way to know which topics to prepare in detail. I joined PG in 2010 and started noting the questions, as you can see in this diary, that came in exams of my seniors. Obviously, dividing it according to topics is going to be much more useful. iLearn website lists the DNB exam papers very nicely. Remember that the person sitting across from you has 20 to 30 years of experience in the branch, so he can make out if you are trying to dodge a bullet or you're trying to answer honestly. The examiner notices your way of answering. Being confident in your grand viva or case viva is very helpful. Also be mindful that honesty is a sterling quality along with a positive frame of mind. Saying I don't know is better than making things up. We have to adapt and learn in the COVID times, and let's look at some useful resources. Spotify iStudy Group is a good website to practice reading out various scans. iGuru is another useful resource for exams, and you can practice how to answer for images of OCT, topography, and fundus. For identifying the images of specific disorders, Atlas of Ophthalmology can be very useful. Glaucoma resource for improving your diagnostic skills is gonioscopy.org. It is essential to observe and practice examination techniques meticulously. For your exam, knowing the principle and the documentation is very important. Of course, if you actually have patient viva, then taking all precautions related to COVID is very important. During quickly finished surgeries, you can miss a lot if you've not read well. And in your exams, you would not just be answering on questions related to instruments, informed consent, the alternative steps of surgery, options, and techniques can also be learned by watching videos if you're not getting adequate number of surgeries currently. Apart from the final exam thesis, viva, working hard on research projects is useful in your academic career. Examiners often ask about landmark trials and treatment guidelines in viva. Yes, we are all fed up of webinars, but they do have a role to play. A lot of free content is available, be it PG teaching programs, masterclass by AIOS, focused learning sessions on niche topics. You could gain exposure to different ways of doing things and topics that are new to you from comfort of your home. Not knowing the exact diagnosis is not a crime, but in your exam case viva, you should be able to demonstrate or narrate the examination technique properly, and you should be able to narrate a differential diagnosis with a future plan of action. If presented lucidly, this will secure a favorable outcome. Be it the first month of your residency or exams looming very close to you, it's never too late or too soon to pick up your books and begin the journey of learning. Before and after seminars, case presentations, or journal clubs, be it online or offline format, teaching your juniors and discussing amongst your peers is always going to enhance your learning. And reading up before approaching mentors is a good idea. They generally help out. Whether you're a night owl or a lark, reading daily has to be incorporated early on, else the days will slip by really fast. Being mindful helps, but what helps most is having a proper sleep and study schedule in the days leading up to the exam.
Dr. Sonal, if you could summarize, please. Thanks.
Your preparation if you don't try to
just
build your
one more slide.
composure. When one can't go out for a purpose, example, the libraries are closed, go within and you will find all solutions. Using apps like Calm to help maintain focus would help immensely. I'm talking of a calm state of mind in the year that has upturned everything, not just have our group photos transformed. The life around us has changed drastically, yet we can choose to be calm and composed. You may have been posted in COVID instead of ophthalmology. You may have got less number of surgeries, or God forbid, even fallen ill. You can prioritize whatever time that remains and attempt to give your best in your PG exams. Giving somebody the gift of sight will be your real exam. So learn for the joy of the noble branch you chose, not just the exam. This is my last surgery before my exams, and I'm operating under the guidance of my mentor. Wishing you a safe time ahead and hoping that all of you sail through your exams with flying colors.
Thanks, Dr. Sonal. That was really amazing. Next, we would take all the questions at the end. Next, I would like to invite Dr. Avnish to speak on acing the ophthalmology residency program. Dr. Avnish Upadhyay.
Is my slides visible?
Yes. So Dr. Avnish is working as a retina consultant at IQ Super Specialty Eye Hospitals, Gurgaon, and he is the joint treasurer of YOSI as well. Please continue, Dr. Avnish.
Yeah. Thank you, Dr. Devakant, and thank you, MOS and BOA, for having me here. So let's get going with this. So 1 second, I'll just push this thing up. Yeah, sorry. So how do you actually, like, let's go back before the tensions what Dr. Sonal Kalia could actually create, and let's get back to a bit more easier times where, you can actually get laid back and, you can get about with going ahead with how to prepare for your residency. So 2 year or 3 year. Let's see how it goes. So the next thing is like the residency program actually comprises of these 5 points, which is one, theory, then surgical, research, that is the thesis, the clinical acumen which you gain through your patients, and then finally the examination, which Dr. Sonal Kalia talked about. Let's come to theory. I think when you're transforming yourself from an undergraduate to a postgraduate person, I mean, the initial 3 to 6 months are a bit difficult. So that is the time you kind of get oriented to the subject, and that is where anatomy and physiology comes into picture, followed by doing your refractions. And coming to the clinical books, we definitely have the Kansky, which actually talks about a lot of that has a lot of illustrations. And from our Indian authors, we actually have a very good book by Dr. Zia Chaudhary, where you can actually have a very comprehensive literature in that. If you want to add more to it, then you can actually go to reading in Yanov. One thing what Dr. Sonal Kalia also pointed out was making notes. I think the idea about before actually going into exams is basically going to those, you should be able to gather all your question bank and, the last 10 years or so. And from there, you can start going retrospective and, finding those answers, because most of the times the questions are repeats. So during your exams, what you can do is basically, if the questions are repeat, you can actually save time. So one should prepare or make notes depending upon the question bank, which I personally feel. Now, coming to like normally what happens is we used to write, but in the present era, we can actually start making notes on our phones itself. And these are some of the apps which one can download. Now, coming to the present scenarios, we definitely have Zoom lectures and, like where you have case presentation or somebody's having a symposium and so on. So one should actually record these lectures and they can actually have it in their stack so that they can go back and they can actually see what was presented and they can actually learn from them. These are a couple of more apps which are available, which one should go through. This is another, these are a couple of more apps which you can actually search your literature. But this one is this Prime PubMed or PubMed Hub or Mendeley or Researcher, where you can actually go there and see whatever patients or any clinical scenario which you can read and talk about. And this is like, you can actually download the app. We definitely have the Telegram, where you can actually have a lot of freebies which you can download and you can discuss. Coming to additional online resources, we definitely talked about PubMed. We have our own Indian Journal of Ophthalmology, which actually talks about, which has very good content. We definitely have eOphtha. I think most of we being a resident, we have definitely read from eOphtha, and we definitely have the newer ones, which we have the Cybersite, which has been there, which has a lot of good content, and we have the iFocus Online. They have weekly contents as well. If you are a member of an AIOS, you definitely have an access to one network access, which has, you can actually get a lot of details to a lot of journals as well as a lot of literature through this access. Coming to webinars, I think it's been talked a lot. What I understand is it's very subjective and one should actually look into the webinars which has good content and all those topics where you find it very interesting or which you are weak in. So these are the webinars you should pick up on. Coming to more online resources, we have this more on core iWiki, iGuru, which Dr. Sonal also talked about. There is this iRounds and ICO as well. There is this Cybersite, which we had discussed. We have the Spotify, which Dr. Sonal also talked about. And we have the DNB webpage also has the list where you can download the DNB questions. And the iOS CME series is also available. Coming to YouTube, actually YouTube also has a lot of ophthalmology lectures. So there are a lot of channels which you can directly go and access to, and where you can actually learn a lot of case discussions, a lot of lectures, and a lot of PowerPoints are available where we can actually get a hands-on to. These are the some which we have discussed. Now, once you have honed your theory part, let's talk about clinical skills. I think in these difficult times, whatever patients you can get an access to, like always maintaining the COVID norms, and you can actually go and have a good discussion of, you can take history, you can do a refraction for those patients. You can do a very good slit lamp examination and followed by 90D and indirect examination. And if possible, you can do an applanation and gonioscopy of those patients. And the more you do it, the more you learn. This is what it is. So if possible, as much as you can, you should do. Now, along with the clinical skill, the cases which you actually have to present in your exams. So there are, again, no financial interest here, but there are a lot of newer available for clinical skills. Investigations, I think there are a lot of machines which are available during your in the setup, and what happens is, like, we should be knowing about these machines because it is basically being asked during your case in your viva. So to name a few, we have the ultrasound, you have the IOL master. You should be very good in actually doing your squint examination. You have the pentacam, you have the OCT as well as the HFA. Coming to the surgical skills, I think one should, like, before actually doing surgeries onto the patient, one should actually observe your seniors, and then followed by assisting your seniors as well as your mentors. And you should do a lot of wet lab actually before going on doing surgeries on your patients. You should actually, when you are doing your surgery, you should evaluate the patients preoperatively. You should record your surgeries to see what steps you are going wrong, and so on and so forth. And post-operatively, actually, you should follow up your patients, because that is how you would learn better. And what I understand is, it's not the number of surgeries, but the quality of surgeries which you can do during your residency that would actually help you. These are some surgical apps which are available to get you can download. That is this.
Okay, Avnish, if you could summarize, please.
Yeah, please. These are some of the YouTube channels, and one more part is the thesis, which you should be is also part of your curriculum, where you have to choose your topic for having a good review of literature, and you should choose your topic according to your mentor and try to finish it 3 to 6 months before your final exams. The conferences are a bit far-fetched right now, but later on we can definitely talk about. I think you should attend state conferences and national conferences, especially for networking as well. This has been discussed by Dr. Devakant, and examination was talked about by Dr. Sonal. Thank you. Thank you.
Thanks, Dr. Avnish, for summarizing quickly. Next, after we have completed the residency, the biggest question which comes in our mind is about how to choose the right fellowship. So here we have Dr. Rishikesh Kaza, who is currently working as a consultant in UVA in LV Prasad, Hyderabad. He's going to speak on finding a fellowship fit. Dr. Rishikesh. Before Dr. Rishikesh starts, I would just request Dr. Shail, if you want to add something.
I think the presentations, both the presentations were fantastic. I think two things that have changed in the last, I would say, only 5 years or so, is the amount of resources that are available to residents free of cost. So I think with this plethora of resources, I would suggest residents to choose the websites and the materials which are relevant to our part of the world. So a lot of them have case discussions from, say, USA, so on and so forth. There, the patient pattern, the case patterns are likely to be much more different than the common cases that we are likely to see. So when you choose an online material, choose something which is more relevant from your perspective. Therefore, the YOSI sites or the AIOS teaching programs and AIOS booklets are likely to be more helpful. And the second most important point that I was always told during my residency was that we often get tempted to try and go into details of things that we are fascinated with or we are interested with. So keep in mind that in residency, it's the best policy is to know a little bit about everything rather than everything about only one or two things. So try and have a broad horizon. You have a lifetime to choose your fellowship and your subspecialty. And try to know a little bit about everything. So these are a couple of points that I would have liked to share. Yeah.
Thanks, Dr. Shail. Dr. Rishikesh, over to you.
Thank you, Dr. Rohit. Thank you for the opportunity. And I'd really like to take this moment to thank all the organizers today. So without any further delay, let me start with my talk. I'll divide it into a few questions, and we can first start with a question that, do we really need a fellowship? Do you need a fellowship? So I'm sure you would all find great examples around you of people who haven't done a fellowship but have a good practice going on, and so there are certain factors which come into play here. So I think it's good if we can try and ask ourselves this question: do we really need a fellowship first? And the various factors which you might want to bring in here first are: where will you be practicing, whether it's a city, a metro, or it's your hometown. Second, how hands-on was your residency program? We saw very good points on how to ace your residency program, and how you could make use of it. This is the next step. And if you have made use of it, are you satisfied with that? So that's another important question which you need to ask yourself. And the third question, which I'd put forward, is whether you want to continue in India, because the general concept, though you learn a lot in India, the surgery wise or medicine wise, but if you do want to go abroad, then this might be the right time to step out, if at all. And finally, everything comes down to confidence, because that is what you need to deal with the patient independently. So once you assess this and you think that yes, you do need a fellowship, the next question you need to ask yourself is, why do you need a fellowship? This could range from, the answers could be multiple here, and three of them I've listed here. Whether you want to learn what you've not learned in your fellowship, or what you've not learned in your residency program. You've learned something and you've understood it well. You like the subject, but you want to dive deep further into it. Or another answer could be that you want to gain a mentor for life, which is the case for most fellowships, and all of the people present here who have done a fellowship will account for that and say that they have actually gained a mentor for life by doing the fellowship with a certain person. Now, there may be an ideal way to think, and I'll discuss just a minute on this, that central to whatever you're doing is dharma, is the right thing that you want to do. But I'd like to point out the four circles, the larger circles that you have: passion, skill, usefulness, and compassion. Now, if you mix each and everything, you have charity, service for usefulness and compassion, and occupation, where you've combined skill with usefulness. So this is where we all lie, and you would want to move towards the center. Now, where your fellowship would fit into this is what we need to think. Now, if we try and place all these points together, then if you ask yourself the question that, why do you want to do a fellowship? The answers could range from, I really like doing retina, or I really like operating surgical retina, or I want to practice in a group where there are three people who are already there, and this is the fourth subject which needs to be covered because I have my family taking care of the other three, or let's say your partner taking care of the other two, whatever. Third could be a peer pressure where everybody's doing it, so I would also like to go for it, which is not wrong, which is the trend most of us follow. Fourth answer could be something like, I want to read retina in more detail. I want to go deeper into the subject, or I want to read oculoplasty in more detail. Another answer here could be whether you want to run a practice with a certain specialty involved, because my brother is taking care of this. I'm just giving an example out of the blue. It's not that this would pertain, but you can try and fit into one of them. Another point could be that I want to acquire the skills related to a certain subject or certain degree, like let's say pediatric ophthalmology and strabismus. I want to obtain the skills to perform strabismus surgeries independently. And I want to find the purpose in life in whatever I'm doing. And never forget that money is also there. It's an important aspect of us. So for us, so then you concentrate on that, say that I want to earn more money eventually. And one other point could be, where can I grow? I want to do this differently so that I can grow in this field where there are not a lot of people who are currently doing it. So your answers could range from all of these. I mean, there could be much more to it than what I've covered, but let's say that these are the answers which you're looking to. Now, which fellowship to choose? Now, this is the point which we were coming to. The first point of interest would be passion, where you want to evaluate whether you're passionate towards a certain subject or a topic. The second would be institutional or private practice. Third would be location. Fourth would be the residency program which you were involved in to think of, and what can help you grow. And finally, the type of surgeries. Now, what I mean by the type of surgeries is, suppose you want to be involved in the surgical aspect of it, then oculoplasty may be good for you since that gives you more hands-on with the surgery and the bloody side of it. So if you evaluate these 6 points, now if we look at passion, if it's a concrete passion, then you should go ahead and take up the individual subject because that's where your heart lies. But if it's a passing interest, you need to rethink, because you may not know what you want unless you actually do it. If that's the plan you're going to. If you're going to be an institution versus private practice, sometimes some subjects like, let's say, neuro-ophthalmology or uveitis may be more suited for institutional practice. Having said that, I'll still say that there are so many examples in front of us who've taken different subjects and have done very well in private practice also. So this is not a rule, but an opinion, and treat it that way. And finally, location, because you might have to alter what you are choosing as per the needs of the population in your location. And this could range from the various specialties and listed below. But let's try and make things even more simple. If you look at conventional fellowships versus unconventional or non-conventional fellowships, you might want to do something fancy or try and do something different, or you would like to follow the herd. But there are 3 ways to look at it. You could do something fancy, like, let's say, surgical retina, and be average at it. You would like to do something different, let's say neuro-ophthalmology, and be really good at it. Or eventually you can aim to become good at each and every fellowship that you take, that you choose.
Rishikesh, if you could summarize, please.
Yes, I'm coming to that. So let me summarize what I've talked about in the final, let's say, a flowchart. Now, this is just a representative flowchart, and you can develop your own flowchart in your brains. So you've answered the question that you want to do a fellowship. And let's say there are 4 ways to go about it. If you're passionate about a subject, then go ahead and choose that particular fellowship. If you are really undecided on what to take, the fellowship you could go for is a comprehensive fellowship, and you could have the option to choose the specialty later in the last 1 year or 1.5 years and so on. Now, if you want to practice at a certain place or a city, or you have some specifics, like some family members are doing a certain specialty and you would like to do something else, or you want to get involved in a pattern or a group, then you have specific fellowships for you. Again, the range of fellowships which will be covered later. Or if you want to fill the gaps which you had in residency, let's say specific knowledge gaps, let's say I was weak in retina and I took up a retina fellowship. So I would go ahead and take that so that I want to deep dive further into it. Or I would like to cover multiple areas because there were a lot of gaps in my residency program because of teaching or whatever be the reason. And here you could go for a comprehensive fellowship again and instead choose your specialty later. So this, I'd like to end my talk here. Thank you.
Thanks a lot, Rishikesh, for the wonderful thought process and the flowchart. I'm sure it made things simpler for a lot of us. Dr. Ashish, any quick comment on your thoughts on how to choose a fellowship?
Thanks, Rohit. Thanks, Rishikesh. It was a wonderful short summary of the last slide, and I know it's very unfair on our end and the session that was there before because all our 4 times are curtailed. But wonderfully presented. If you ask me, I was under peer pressure because everybody was doing fellowship. I ended up doing a fellowship, but your presentation made things a lot more clear, I'm sure, for the young ophthalmologists. Thank you so much.
Thank you, Dr.
Thanks, Dr. Ashish. Next, we would invite Dr. Janil Seth. He is currently the consultant in pediatric ophthalmology at LB Prasad. He also got the best fellow award during his fellowship. He's going to guide us on how to do the fellowship the right way. Dr. Janil.
Very good evening to all. Are my slides visible to everyone?
Yeah.
So thank you once again, Dr. Rohit and members of BOA and MOS for inviting me here. So let us straight away get to the point. So the topic is fellowship, doing it the right way. So I would like to thank the previous speakers for making my talk a little easier because you have covered lots and which would overlap in this talk also. So why is it very important to be in fellowships like Dr. Rishikesh just previously covered? And fellowship itself has a very varied context of its meaning. But as an ophthalmologist who has just done his residency, what does fellowship do? It is an opportunity to focus on your professional development career, and at the same time, it also enables you and empowers you to create an opportunity for yourself and also possibly for others to excel in the field of your area of interest, which you would not get opportunity in many other fields. So I finished my fellowship almost close to 3.5 years back, and when I was told just a week back that if I would like to present this, and I was thinking what all points did I think of when I was going through my fellowship. So I made these 5 mantras, and we will talk about each one probably for a minute to wrap up in 7 minutes. So what is the first step? I think the first step is a very crucial step, which would remain equivalent even when you are selecting your fellowship, even when you are already into your fellowship, or maybe even residency, is to select the right one. If you're not sure about your fellowship and about your choice, and you intend to do retina, but you'll end up doing cornea because you often give 2 or 3 choices. And I think that's when the things go downfall. So selecting the right one is the most crucial and important part. So molecular diagnostic. Yeah. So it's very important to start working from the second year of residency itself. I think by the end of 2 years, you have already spent in majority of the different sections of ophthalmology enough to at least understand that this is your probably area of interest, and start talking with mentors, with colleagues, people who are doing fellowships, seniors who are senior registrars or who have already finished their fellowships, to get more more interest into it, that okay, this is my area where I really want to work in. Now, there are many questions which usually are considered as a taboo when you are in your fellowship or residency, that money does really matter. And I believe it really matters, and it's really important for all of us. So are there a few fellowships which really is more money making as compared to others? But the question you have to ask yourself, is it really going to more matter than your passion and then your career? And that is where you decide. I mean, it is not wrong to decide to take up a cataract refractive fellowship, and it is never wrong to decide to take a retina or a pediatric fellowship. So basically, you really want to choose what matters to you individually. You take inputs for everyone, but you eventually land up selecting what is you are really passionate about. So what is the second mantra? Once you are into a fellowship and you divide and conquer, what do you divide into? There are 3 most important aspects in fellowship, that is surgical, clinics, and the research. And research is here which I want to emphasize upon, since in many of the fellowship programs, you may not get the opportunity. There are excellent surgeons, there are excellent clinicians, but there are very few researchers. And that is the area which you really want to excel in. And that is what many institutes still give you, encourage you to do so. So in order to divide this equally, it's really important in any professional career is time management, which is the most crucial thing. And I think all these decisions of dividing equally or maybe unequally, you can choose your own weightage where you want to put more weightage on. Someone wants to excel in surgery, someone wants to excel in all 3. But all this has to be done in the first 6 months of your fellowship. And this is how, again, your role of mentors, role of your colleagues, role of your seniors is really important, which I really had benefited from all of this. So this is where you think about your future. This is where you think about not only of your next 1 year or 2 years of fellowship, but this is where you think about your entire professional career, that where you want to go about. And since you are already decided your field of area, you again decide more about where you want to focus on one of these areas. So before I move on to the third mantra, I would like to quote this beautiful quote by Sir William Osner, that it is astonishing with how little reading a doctor can practice medicine, but it is not astonishing how badly he may do it. So with this, I come to my third mantra, where focus and determination is the key. Yes, but what does one need to do once he is into fellowship program? Residency does not mandate the end of reading. You need to keep reading. You need one standard textbook, and you have to read it cover to cover. You may read for exams in residency. In fellowships, you read for patient care. So one standard textbook needs to be completed. And like my mentor always say, it is good to read 10 times a single textbook rather than 10 textbooks at one time. However, at the same time, one can argue that it is not something which is going to cover everything. You need to be updated. And yes, you need to be updated with all the recent papers. And like shown by the previous speakers, there are so many online things available. You can subscribe to one journal. AIOS gives you access to many journals. You can follow JAMA online, which keeps on giving you recent updates about it. And all these updates, all this subscription, you need to keep on adding to your one standard textbook. And that ultimately is your holy Bible, which you can really follow up even after your fellowship is over. Another important aspect is to always do something new, always come up with one research question every week to challenge yourself, to challenge your mentors also, that what is this particular thing can we do differently. Now, of course, we are talking about a broad-based topic here, which covers 6 specialties. So in your area of specialty, you saw something, you go back and you read. You go back, you read on the same day, you think of something different which we can do, and that would itself be a research question, and eventually maybe 2 years later it could be a publication. So this all things are very important when your fellowship is running through. Coming to the 4th mantra, get your basics right. Often I have seen, and even myself, that we get carried away during our fellowship, that we want to do all the advanced things, but getting your basics right is very, very, very crucial. You cannot do everything in maybe 1.5 or 2 years. So clinical examination techniques, surgical techniques, which are mostly video-based learning. Coming to research, you start with something very small, something, one photo essay or case report, get it finished within the first 6 months, and maybe a prospective or retrospective study question. You come with it in the 6 months and then you go about it. So the manuscript of the study question will be ready, by the end of your fellowship, hopefully, even post-fellowship, which you can continue doing so.
Dr. Janil, if you could summarize, please.
Yeah, this is my last slide. So last one, be the shadow, yet be curious. What I meant by it is be the shadow of your mentor. If you have a fantastic mentor, which you have already put your thoughts into, you are the shadow of your mentor where you move on with him. You could go, leaps and bounds, and sky is not the limit there. So it does make a very important role. So does your colleagues. So learn and discuss again, and keep this cycle going. Again, conferences, educational events, interacting with, networking with people, getting more and more questions every day is again really important. At the same time, one might not discuss this, but really important is to avoid burnout and take adequate breaks during your fellowship program. This would achieve an holistic approach to your fellowship. So just to end with this beautiful quote, there's a secret of getting ahead is getting started. And what I added here to Mark Twain is getting started early. And this would help you in your fellowships. Thank you.
Thanks, Janil, for a wonderful talk. It's great to have Lahane sir amongst us for this session.
Yes. Thank you very much, Devakant, Sahil, Rohit, everybody. I think I was hearing the talk, and it really, it is a very, very essential for the young ophthalmologist. So all the guidance and how they should go ahead, I think that is very good. So I congratulate Devakant, Sahil, Rohit, Dipti, and Ashish. Thank you very much. And all the speakers.
Thank you, sir. Thank you, sir.
Thank you, Swapnesh. Excellent session. Better than what is happening there.
Thank you, sir, for the opportunity.
Thank you.
Dr. Dipti, any comments on Dr. Janil's talk?
Yes, it was such a great talk. I would just like to add a small tidbit from my side. What I think is it's worth doing a small observer post wherever you're planning to go. If you have 2 or 3 places on your mind, and whichever is easily accessible or feasible to go, we can go for a week or 2 and just see, because the subject that we might be feeling is eye candy might not even turn out to be that eye candy once we dive into it. So instead of going and then repenting later, it's worth doing 2 small observer posts in whatever subjects we like, so that we know better whether we want A or we want B.
Yeah, that's right. That's a wonderful tip. That is some. I would like to invite Dr. Digvijay Singh. He's the current president of YOSI. Thank you, Dr. Singh, for sparing your valuable time. And he's covering one of the most important topics is standing at the crossroads, options after completing ophthalmology residency. Dr. Digvijay, over to you.
Thank you. So I think some of what I'm going to speak has been covered. So I'm going to run through that very briefly. And so when we took at ophthalmology training, it's at two stages that this is happening. The first is at the residency level, and then there is the fellowship level. And at both places, we are standing at a crossroad. So, during residency, and this has been covered, this is the best time for you to learn. This is the time for you to become the jack of all trades, for you to do some research activity, for you to probably publish a paper, see as many patients as you can, read as much as you can, and essentially the time to imbibe, and the time to imbibe as much as you possibly can. After you're done with your residency, then you're standing at your first set of crossroads. Should I go for a fellowship? Should I go for a job? Should I start practice? What should I do next? And this has been beautifully covered by Rishikesh and Janil. And that when should you choose a fellowship? And this is what I'm not going to recover again now. But the idea is that if you're looking at practicing in a big city, you're looking at a group practice, you want to become a master of one. I also want to add the point that if you want to have a mentor for life, these are the kind of situations where you want to look at doing a fellowship. And that has already been covered. The second set of crossroads that we are back at now again is, should we look at a job? Should we look at practice? What should be the next step? So when do you want to choose a job? I think that is most important, because for most people, probably the first natural step may be a job actually. And you want to do this particularly if you're having an academic and research interest, which you want to continue to cultivate, because that's where a job will help you focus on that thing. If you're looking at something with a stability or a fixed salary to begin your life with, you begin your professional career with, that's again a place where the job is going to work very well for you. If you want to focus only on ophthalmology, you want to focus only on the clinical side, you don't want to look at administrative roles, that's again where a job works for you, because somebody else is usually taking care of those issues. Unless until you're doing a practice in a multi-speciality hospital where you could basically be in the middle of a job and a practice with less administrative work on your head. Or if you're looking at, if you're financially you're not very, not wanting to invest too much, essentially, that's again where your job will help you, because you don't need to invest in that circumstance or in that situation. As a practice, work on your head. Or if you're looking, if you're
Dr. Manoj, please build
in a certain area and you don't have a patient base, so you're the first generation ophthalmologist, then again that's where a job would work best for you. And if you're looking at an international opportunity, because setting up a practice internationally is a big task, you first have to go through the job route there. So what type of job to choose? That becomes the next obvious question then. If you want to look at a medical college or an academic institution, you should think of this one if you're looking at a long-term career path. So if you're just looking at doing something for a few years, it doesn't make sense to get into a medical college. An academic institution as well, you need to look at a long-term career path. These places take time for you to develop your skills overall, because you will be lower down in the hierarchy and you have to build up as you go along. If you're having academic and research interests, then of course, and if you're looking at stability, this is probably the best place to be in. A corporate job or a private job or even a public sector non-academic job is something that you can look for probably in the short or medium term, if that is what your career plans are. If you are looking at reasonably good salaries, but you're looking at building a reputation, building a patient base, looking at it as a stepping stone, these are the kind of jobs that you can look at. Or like I said, if you want to focus only on ophthalmology, you don't want to look at the administrative side of things, that's again where these would come in handy. And the salaries here are a little better usually than the medical college or the academic institutions. In most places, I would put it like this now. And that's where you want to look at this particular kind of a job set. Another type of job that you could look at is a charitable setup. And this is something that a lot of us do in the beginning. Here it gives you an opportunity to improve your clinical and surgical skills. So if the residency had not given you all that skill that you needed to have, then this is a good idea. This is a good stepping stone. Look at a charitable setup. Though the pay is less, but it is usually professionally very satisfying. And you can be there, build a reputation for yourself and help build a patient base too, though the latter is more difficult to do in a charitable setup, because the patients you are getting there are less likely to be ones who will follow you anywhere else. Internationally, there are limited opportunities, but there are jobs which come about. Usually these are in the form of fixed tenure contracts or a few year contracts. There are licensing issues, and each country or each opportunity would have its own kind of challenges, and you need to kind of license yourself there. And there is usually a path again to take for that, and that's usually a little long, but that again pays you quite well in terms of your salaries. So that's the job part of it. When should you be looking at starting your own practice? Right away after a training? I think one, that if you're in a smaller city or a town, you're not in a metro city, you're not in a tier 1 city, you can look at starting a practice, because there is a dearth there and you will be, in great demand. And with your kind of a jack of all skills, jack of all trades, that is what is required in such a situation or such a city in that case. Secondly, if you're thinking of returning to your hometown, that's also when you want to start your practice. You want to start it early. You don't want to be, waiting too long in a job. And very often in the smaller cities and towns, you probably will not get a satisfying job experience. If you're a second generation ophthalmologist, and let's say your first generation was in a job or they had a basic setup, then you must get into practice soon, expand it, build it beyond that. If you're looking at a group practice, if you're having some partners, that's another reason where you want to look at starting your practice soon, because each of you can support each other, each of you can complement each other. And if you're wanting to generate or build a particular specialty within a system, that's another place where you can get your you can look at starting a practice. I've written here, if you've got little or less interest in academics and research, that's probably true, because in the beginning, when you start a practice right away, it takes a lot of your time away in that. And so, if you are somebody who's very keen in academics and research, then you probably want to step back a little bit on that. Not to say that in jobs people are not doing, in fact, doing a lot of academics and practice is also happening. You can have other roles to play, and I'll tell you my story and you'll see that. See, this is my story. I started doing my ophthalmology training at RP Center in Delhi as a junior resident. I finished my residency, then I shifted. I became a senior resident there, which is more like a fellowship, where I looked at strabismus, neuro-ophthalmology, glaucoma. Because we'd been through rotations in the units, I kind of already knew what I wanted to do in the next step. After that, I joined as a senior research associate there for some time. At the same time, I got an opportunity to move into a corporate hospital, which is Medanta. It's a big corporate hospital in Gurgaon, in my hometown where I'm staying currently. So I took the opportunity, started on a fixed salaried job, but also helped build my patient base in this area. Along with this, I'd started doing some research job with the NHS in UK. And after about 3 to 4 years,
if you could summarize, please.
Practice, which is the Noble Eye Care now. And I've joined a couple of multi-specialty hospitals as a visiting consultant, because as my neuro-ophthalmology requires me to have other specialties along with that. So in one way, that is kind of a story that you can easily develop, where you decide, you set up your priorities in the beginning and you follow them step by step, and it leads you to a growth in your career. Thank you. And I thank BOA and MOS for this opportunity, Rohit and Deepika as well.
Next, I would also like to invite Dr. Abhishek Hiranjan. He has started his own retina center in Vapi, and he is one of the perfect person to explain us how can we set up our own practice. Dr. Abhishek.
Sorry for the delay. I'm just sharing my screen right now. Okay. Am I audible?
Yeah, Abhishek, you're audible.
Okay, great. Right. Good afternoon, everyone. I'm Dr. Abhishek Hiranjan, ophthalmologist, vitreoretina surgeon, medical director of Advanced Retina Care Center, and co-director of Anu Eye Hospital, which is situated in South Gujarat. Anu Eye Hospital has been catering to the masses of South Gujarat for the past 33 years, and Advanced Retina Care is being run by me for the past 2 years. Currently, we have 3 branches in Vapi, Valsad, and Daman, and we are in the process of opening our 4th clinic shortly. Today, I am here to guide all my young fellow ophthalmologists to give them a few tips on setting up their own practice. In India, the following happens to be $1 million question for all ophthalmologists post-PG. It is difficult to answer this question as our individual priorities may vary, as earlier said by our colleagues. To begin the career in a government institution or a high-volume private sector seems to be an easier way out as compared to starting a private practice from scratch. So, but for those who wish to take the road less traveled, the road to private practice, here are a few tips for them. To start, it is very important that we are able to answer the following questions, the H's and W's of planning. So as of now, there are many options today, joining an academic institution, corporate hospital, charity hospitals, or some may pursue even further training. So why private practice? Now, statistics say that almost 80% ophthalmologists are eventually involved in private practice. So there is a high chance that even though you start with something else, you will end up in private practice. Interestingly, almost all corporate chains, large institutions, NGOs, etc., also started out as private practice and then they scaled up. So now, when do we jump into private practice? You should remember one thing: compromise on anything but competence, be it cataract surgeries or simple refraction. The time to learn further is now, so do not postpone any further. Also, you need a basic startup fund. So either you should have some surplus fund or enough security to opt for a loan. So where do we start? So remember one thing: you need an initial referral base. And it's always advisable to visit senior practitioners in the area and see the patient profile, etc. Because you might never get a chance later. Explore the city and market before going on deciding a place. Unfortunately, in our country, marriages are a common reason for intercity movement, more often for females rather than for males. So my advice is not to rush post PG. Start a setup once you have settled down. And in my experience, talking about multiple attachments in different centers, since I have been running my setup in 3 different cities, it sometimes becomes difficult as a patient expects you to be there all the time and not just for 2 to 3 years. So initially go for multiple attachments preferably, but in close vicinity. So here are a few pros and cons on tier 2 versus tier 1 cities, which I feel exist. So these are my opinion. Your opinions might differ. Now, smaller towns and cities are more economical with the best potential markets as they are not yet saturated. One ends up being a common name sooner. Monopoly in private practice is possible in rural setup, whereas bigger cities have expensive infrastructure and startup costs, and the markets are often saturated. Recognition here can sometimes take much longer. In a rural setup, maintaining good relationships is mandatory. It is easier to be the sole owner of your practice, at the same time grow fast. Whereas in an urban setup, due to financial limitations, it's easier to collaborate and be partners in order to grow faster. Another thing I want to highlight is the availability of resources is very poor in rural setup as compared to an urban. Now let me explain. Small things like AMC, train staff, renting machines or transporting machines between setups is very difficult. And also if a machine breaks down, I don't get a replacement from the company while machine is being repaired. So in an urban city, these constraints are far less. Also, insurance and cashless services are easier to avail in urban centers, and the paying capacity is usually better in urban setup than rural. Lastly, a challenge for both: in rural setup, services are undervalued as cheaper services are offered by NGOs and charity hospitals, which are more in number in rural India. And here, the urban cities, whereas in the urban cities, there is a general skepticism and lack of trust amongst patients. And here the private practitioner has to compete with larger corporates and multi-specialty hospitals. So now when we are done with the why, where, and when, and you know where to start, how do you start your private practice? So one way to go is go for lower risk options in terms of place and equipments. Example, first, a basic consultation room with OPD instruments. Next, an adequate waiting area with reception. And then third, maybe a procedure or an OT room later. So start at a smaller scale, but invest further as the practice grows. The second would be, if you have hassle-free funding, start with a bang with all the latest equipments. Also have an effective marketing strategy. But remember one thing, do not compromise on surgical results and safety at any cost. So while buying equipments, economize to the maximum extent on OPD equipments and furnishings so that you can concentrate funding on surgical equipments. Like phaco is the bread and butter for a general ophthalmologist, and similarly laser for medical retina. So try to buy in groups with your friends and colleagues, because you get better negotiation deals with the companies. Also, some companies take deferred payments, they give you interest-free loans, or they have IL bundling options, which is a good option. Refurbished equipments and second-hand equipments are also very good options, which will be covered in our next talk. Reusability of consumables are very essential as they reduce the cost of procedures. Now for all this, who can help you? So I tell you, you should build your team. Try to get at least 1 to 2 trained staff. supervise everything. Do not try to do everything yourself, and set some standard operating procedures instead to minimize errors and fix responsibilities. Initially, keep few staff who can multitask between OPD, OT, and reception, etc. Send them for training if needed, and ensure special skills like patient handling, conflict resolution, insurance settlements, cashless, etc. work smoothly.
Dr. Abhishek, if you could summarize, please.
Yes. So what else? You should also hire a marketing team who can, deal with your. You can hire a marketing team who can devise a marketing strategy for you. So with the entry of corporate sector in healthcare, it has become a necessity, and web-based marketing and digital platforms like Instagram and Facebook go a very long way. Organize awareness activities, meet other doctors, be involved in local bodies like BOA, MOS, and what else? So there are some basic rules and regulations that you need to follow. You should know about the Labor Act. You should know about the Clinical Establishment Act. You should know what are the Consumer Protections Act. You should know where to get the biomedical waste management done. And also in these times, you need a fire safety policy. And malpractice insurance and indemnity hold very good in these times, because when something goes wrong, these are the ones that can help you out. And ignorance of the law is no defense. Well, if you have any more questions, you can always contact me. And the take-home message would be, there are no secrets to success. It is the result of preparation, hard work, and learning from your failures. And what I would suggest is, any person with average skills combined with excellent interpersonal relationships and management would score better than a person who has excellent skills with mediocrity in every other field. Thank you.
Thanks, Abhishek. That was a wonderful presentation. I would request our BOA secretary, Dr. Swapnesh. She's running a very successful practice in Mumbai, to share a few tips with us. Dr. Swapnesh Sawant.
Thank you, Rohit. It's a very interesting session, and I've worked with Abhishek myself when he was traveling from one hospital to another hospital. So setting up a practice is very important. I would strongly suggest that when you are in your early career, don't waste even 6 months. You should continuously look out for opportunities to get your education completed, gain as many degrees as possible. Once you are at a level, once you are postgraduate, once you have entered a fellowship, then it should be the primary aim should be to gain the skill set, because if you don't have the skill set, you are not going to do well. Once your skill set is developed, then you have to market your skills. So that's where the networking aspect comes, which includes setting up, having a good relation with the local doctors. And once that is achieved, then please don't undersell yourself. So there are 4 stages, and this is how your mantra should be.
Thanks a lot, Dr. Swapnesh. So I'll just quickly go through the last talk of the day. Is my slide visible?
Yes, it's visible.
Yes, visible.
Yeah. Sure. So I would like to acknowledge BOA, Lahane sir, Ragini ma'am, Dr. Swapnesh, and Dr. Preetham Sawant for giving us the opportunity. Also MOS, Dr. Parishit Rokte sir, who has been a big support, and the whole YOSI team. So no financial interest in any of the products or any companies mentioned. So why to think about refurbished? And we know it's all about money. A rupee saved is a rupee earned. And how much we can save. Most of the stuff we get refurbished is at least at a 50% discount. Many times it can be upwards to 70 to 80% discount. And the basic thing which one of my uncle and my father always insisted was to understand the fund of return on investment. That's a net profit what we have made over the cost of investment. And this is very important for us to understand, because this is something we tend to overlook. And the thumb rule is of 4 years, that you should recover the money what you have invested in equipments within 4 years of buying it, and it should directly come from the equipment itself. And well, so being a Marwadi, there is a funda what we say. there's a 1% per month depreciation on any equipment you buy, and there's a 1% per month interest on the capital invested. So the funda is, if you have extra money as a Marwadi, you give it as a loan to somebody, and that person pays you 1%, money. So basically, to understand the value of investment, that is taught to us. And hence 2% per month should be return on investment on each equipment. So suppose, let's say the investment for your whole ophthalmic setup has been 1 crore. 2 lakh rupees is the depreciation amount you should calculate every month. So whatever you're earning, let's say you're earning 8 or 10 lakh rupees a month or 5 lakh rupees a month, you should deduct 2 lakhs from that, keep it separately or invest in something, because that is going to help you buy more equipments or take care of the existing equipments. And that roughly comes to 4 years also, same as a rule of thumb. Now let's look at an OCT machine, which is of approximately 20 lakh rupees. So per month, you should be able to make around 40K directly from the scans you have advised. Now, if you buy a refurbished machine, which is at a 50% discount or a 40% discount, the above calculation becomes half. So the pressure on you becomes half. Now the amount saved could mean less loan required, less interest in EMI, that reduces the stress. And trust me, when the stress is reduced for conversion, the conversions are much more. And we get more money to invest. That's very, very important. And this is what I've learned from Manoj Agrawal, sir. The whole team is going to speak on economics. That if you start investing early, sadly, most of us start investing at the age of around 30 or 35, in fact. But if you invest early, you end up making much more than what you would have done, probably twice as much. And that's why if you are very smart in your investments with respect to ophthalmic equipments, you can save more, invest more. So which are the instruments we can easily think of buying refurbished? I feel the OPD setup, most of us want to have a brand new OPD setup. I would think the otherwise, because, let's say the AutoRef is around, if you buy from a good company like Topcon or Nidec 4.5, the total investment for OPD and a decent microscope is around 23-24 lakhs. But if you see a chair unit and slit lamp, they do not require much maintenance, so they are good for a lot of years. So second-hand one is a good idea. AutoRef K, if you get it checked and serviced by a local engineer, you know that you're getting a good product if it is second-hand. And microscope, if well maintained, optics, they can run for a couple of decades also. So independent engineers are easily available, especially in metro cities, for servicing. And many times, the basic microscopes of good companies like Leica and Zeiss are available if you wait for a few months. So the tips are, we can compare anything which we are buying, the features of this with the latest version. So if you're, microscopes, the changes are not very significant, or in the slit lamp also. But whereas in OCT machine, they can be a huge change. So comparison is important, and we should see what is clinically relevant to us. Always get it checked by an independent engineer before buying. They can check functioning of a microscope, check the quality of optics, and we know that we are going to get the service from these independent engineers. Plan a few months in advance, wait for a few deals, because you may get somebody who wants to sell it fast. And check whether any major parts have been replaced in the machine. That is very important. That will tell you how the machine was maintained. Number of years of usage, because you can bargain a lot on that if it is more than 4-5 years old. And will the original company give service if you bought it from a third party is also important, because a lot of times dealers are reluctant if they have not sold you directly, or they charge a hefty fee. So you can get a local engineer to do that. And some machines may not be available in the market, in the sense, Alcon recently removed their basic phaco machine, which was available for so many years. So the service for that machine, the spare parts for that machine is going to be available for only 4-5 years. So can you get your return on investment in those many years is something you need to ask yourself. Tricky decisions are when you're buying, really expensive machine, something like, a phaco machine or a refractive surgery machine. So you have to look at whether you know the basic knowledge of machine functionality, whether you can, manage minor problems with the machine, what kind of warranty is available, is the seller is giving you any warranty, like there are companies which only deal in second-hand instruments, or if the company itself is giving you a refurbished machine, is they are giving you sufficient warranty. Some machines do, some companies do sell their refurbished machines. And there is obviously a risk-taking ability should be there when you're buying a second-hand one, because they can be unseen circumstances. Now, this is something which was shared by Dr. Raylan with me, and one of the companies was selling their used it is an excimer laser, and they had a wonderful offer that you can outrightly buy it for 75 lakhs, or you can rent the machine for 36 months, and after that the machine can be yours, or you can even pay per patient procedure. And that is really, really interesting that, if you're thinking of a huge investment and if something comes up with a pay patient model. So these kind of offers are also available in the market. Now, machine best to buy new ones, that is my personal opinion, is the green laser, because the laser cavity depletion and fiber optic cable may be need replacement, and this is expensive. Servicing in these machines are expensive, and refurbs are sometimes more expensive. Let's say, example, if you buy a Zeiss refurb, it may be more expensive than a new brand Apaswamy or a Horolab made one. So you may think of buying a locally made one rather than buying a refurb one. And for OCT, now there's a company known as Refurb which gives only 3 months of warranty on OCT. Like I was speaking to this guy, he said, like, for most of the equipments like microscope or a slit lamp or autorev, we're happy to give a year warranty. But for OCT, we give only 3 months warranty. That is really short. And servicing and replacing of parts is really expensive for an OCT machine. And well, if you buy it for a company, I know a friend who bought it from a Zeiss, a refurb Cirrus OCT, and he got a 3 years warranty with some iron bundling. So the cost was, 75% lesser than the original cost. So, but don't be penny wise and pound foolish. Sometimes the decisions can be backfire. So double check, speak with your peers, and it is always good to buy from a trusted friend or a colleague whom you know. And maintenance issues can be there. And sometimes we miss out on the taxation benefits or the depreciation benefits when we buy these machines. This is one of the companies which deals with the refurb. I do not have any financial interest. Thank you for the opportunity.
It was a great talk, Dr. Rohit.
Yeah, I would request Dr. Divyakant if you could just summarize the session. And
thank you, Dr. Rohit, and it has been a wonderful session. And I hope all young ophthalmologists, whichever phase of their life they are in, have had some takeaway point and some extra point has been added to their kitty. And thank you. And Dr. Rohit, can you just thank everybody from us?
Yeah, thank you, Dr. Divyakant, Dr. Digvijay, Dr. Shane, Dr. Dipti, and Dr. Ashish, and all the other faculty members for sparing their valuable time. And once again, thanks to all the BOA and MOS team for having us over here. And again, apologies to Dr. R.C. Shah sir and Manoj sir that we took a bit of time from your session. Thank you. Thank you.